I'm Brant Nikolaus. I'm an orthopedic surgeon at the Utah Institute for Robotic Surgery. So as a fellowship-trained hip and knee specialist, I come in with the newer approaches to hip and knee replacement. So hip and knee replacements have been done for quite some time. The only thing is that people used to stay in bed for prolonged periods of time. It would take them a while to get up. And what we're seeing now is that people do better by getting up faster, getting home quicker. How we approach hip and knee replacement now is patients are up the same day, walking to physical therapy. We use a multimodal pain approach to try to decrease the amount of narcotics that people use after surgery so they can feel better, they can get back to their lives quicker. We try to have the surgery done with spinal anesthetic, so again, people are less groggy when they wake up. And with these different approaches we've been doing, people have been able to go home the same day or after one night in the hospital. And many patients feel that they've had a hip replacement prior, where they went to a rehab facility and they were there for weeks on end trying to recover. And now they come in with this newer, updated approach where people are getting better quicker, they're getting up faster. They really make the comment that they feel so much better this time. Not that anything was done better surgically, it's just we have a different approach where we're treating the patient as a whole and trying to get them better faster and get them back to their lives quicker. And the studies have shown that people do better this way, and that not only is it okay to do it, but they actually do show better quality improvements.